How does treatment help scoliosis? Many patients with scoliosis wonder if scoliosis is treatable and really wonder how can the treatment actually help the scoliosis. And the answer is yes, scoliosis is treatable, but it is not curable because it is a progressive condition and is uncurable, but it's definitely highly treatable. While there's no treatment guarantees, conditions that are detected early definitely respond favorable to more proactive treatment and have fewer limitations of what can be actually be done as scoliosis progresses over time. So the smaller we find a scoliosis, the better results we tend to have. Scoliosis is, first of all, diagnosed as an unnatural sideways spinal curvature that has developed within the spine. And this is called a scoliotic curve. And this has a rotational component, meaning that it's bending and turning. And the bending and turning, the turning is typically into the concavity of the scoliosis. The scoliosis curve has to be measured 10 degrees or greater by using a Cobb Angle measurement system. A Cobb Angle is the gold standard in diagnosing scoliosis and assessing the size of scoliosis. A Cobb Angle is a key measurement that's taken during an X-ray, and the X-ray is taken of the spine, and the patient's Cobb Angle tells me how severe the scoliosis is or how much their spine's out of alignment. And this places a patient's scoliosis on a scale of severity of something mild, moderate, severe, or the fourth category I like to use, very severe. As the severity of the condition increases, so does the effect of the body. And we also know as curves worsen, they also are more likely to get worse faster. So what does progressive mean? Progressive scoliosis means scoliosis progresses over time, that where a curve is diagnosed at this moment is nowhere near where it could possibly end up being diagnosed later on in life. We know scoliosis it's in its nature to worsen over time because of the uneven forces that are being applied throughout the body. So these curvatures, as they increase in size, they also increase the effect they're having, meaning you can start affecting more areas and more issues and more components of the body. As with any progressive condition, the first thing to do is to counteract the progressive nature of scoliosis. We have to stop progressing. We don't always know what causes scoliosis. The majority of cases of scoliosis are diagnosed as idiopathic, but we do know how to treat it, and we also understand that the most common progressive trigger is growth. As patients are growing and they're going through their adolescent growth spurt, this is the most likely time that curves will progress. They also progress in later life. We know curves in patients that are 50 or 60 years of age can see increased rates of progression in later stages of life compared to somebody between 20 and 50. So the key times we need to be concerned about your scoliosis is obviously during growth, but also later stage in life. The issue with later stage of life is that if you let your curve slowly increase in your midlife, you're dealing with a bigger curve when you get there, and then when it starts to progress faster, we've lost all this time that your curve could have been possibly managed, so you're not dealing with what we call this ramping or this snowball effect that occurs later on in life. When we look at scoliosis, we know there's really two main treatment options. Traditional scoliosis treatment is more reactive than proactive, meaning it does very little to prevent progression and is more centered around responding to when curves progress to a severe stage and then treating it with more surgical or more invasive approaches. The reality is that many cases of scoliosis can be treated successfully without surgery, and we know conservative chiropractic-centered treatments can have a positive effect. And the value is a more proactive response by treating scoliosis when they're closer to being diagnosed and when they're smaller, because we know the earlier that we treat treatments, the more that we can actually keep curves into the mild stage and maybe even take curves that are moderate or severe and move them into a category less than their initial diagnosis. The smaller the curve that we're dealing with, the less rigid the spine is, the less it's affected by surrounding muscles, the less time the body has adapted to the presence of this scoliosis, so the easier it is to reduce. The more severe the curve is, typically means the curve has been there longer, and all these things have adapted, so they're harder to change as a result of the scoliosis being there for that length of time. So how does conservative treatment help scoliosis? First and foremost, conservative treatment works on helping scoliosis at counteracting scoliosis' progressive nature to progress, and it must do this on a structural level, meaning if we're not reducing the structure of the scoliosis and we're just helping patients' signs and symptoms of scoliosis, we're not addressing the underlying cause, because the underlying cause of scoliosis is progression over time because of the misalignment, either rapidly during growth, slowly as an adult, but it's progressing because of the uneven forces that are being applied. We must deal with it on a structural level. Chiropractic care, manual therapies can have a structural component if these cares are applied appropriately to help reduce the curve in a positive level. In addition, scoliosis physical therapy and scoliosis-specific exercises can help increase the strength of the body and can be prescribed in such a way that they can have a corrective structural approach to the scoliosis to actually reduce the curve. Corrective bracing can help push on the spine and the body into a more corrected position to help augment exercises, physical therapy, and chiropractic care. And of course, customized home therapy or home rehabilitation program to further stabilize the spine play a serious part in actually getting a curve to actually reduce. So the way you treat scoliosis needs to be treated on a structural level. And the number one benefit in treating a scoliosis is reducing the curve. And if you reduce the curve, you reduce the impact on the body. So treating scoliosis, the most important decision that the patient has to make is determining which treatment approach you can use. Or you can use more of a traditional approach where you're just going to watch and see what happens. And if the curve becomes severe enough or causes enough issues, then you're going to consider surgery. Or you're going to be more proactive and try to reduce curves while they're small so you don't have to deal with the effects of a more severe curve later on. There's no way to predict how much a curve will progress or how many degrees it's going to progress over time. We just know progression occurs either rapidly during growth or slowly in the adult stage. Conservative treatment, we know, manages progression by reducing the curve. And this is very important because the rate of progression is affected by far by the size of curve. So meaning as your curve gets bigger, it's more likely to continue to get bigger. And this is true for adult stages or adolescent stages. So by reducing the size of curve, you're really reducing your risk of progression over time. So that's why we say reducing the size of curve is the best way to stop your curve from progressing over time, because smaller curves are less likely to progress. And we know the smaller the curve, the greater reduction that we can achieve and the greater outcome we can achieve. So the best time to start scoliosis treatment is always sooner the better. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.